live, okay? Good afternoon, everybody. Welcome to Navigate HCR's, our live update for today. And we are going to go ahead and get started here in just a few minutes. So we're going to get started right at probably about 1:30 to give everybody a few more minutes to get on. And just make sure if you have any questions to type them in the chat box. Okay, good afternoon, everybody. It is 1:32 p.m. and welcome to Navigate HCR and our webinar update on COVID-19 and all of the funness that is surrounding what's going on. We hope to be a value add for all of you, and we're just going to go through a couple things housekeeping-wise. If you have any questions on anything that we're going over, please make sure to type them in the chat box. We are keeping track of those questions and we're going to be answering them as best as possible. And you know, if you have anything, let me know. I'm going to go ahead and start here. So we are, again, Navigate HCR, and here's a couple things we're going to go through to talk about today. We just have a couple quick sections. Introduction, we're going to talk about HIPAA, FMLA, unemployment, the upcoming and pending legislation, and then we'll go through some questions at the end, so make sure you have those ready for us and we can go through those too. And then we'll talk about some additional resources and, of course, how you guys can contact us. Please, 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 if you have any questions, let us know. So just a couple of housekeeping rules. Again, we are recording this webinar so that you guys have access to it if you want to watch it in the future, or if you would like to share, please go ahead and do so. Please mute your line, and you should all be muted. If dialing in on your phone, make sure to not put us on hold. We do hear that music sometimes. And again, like I said, make sure you submit your questions via your chat box, and we'll address those questions at the end of the presentation. So for any of you who do not know, we here at Navigate HCR are a full service compliance consulting and technology company. Our goal is to assist employers and brokers with all of the complex requirements of the law. All of our team are experienced human resources and compliance specialists, and our goal is to be a value add to you and your team. So we're here to walk you through that entire process. So next up, I am going to introduce Angie Sura, who is our VP of Compliance. She is a former broker and consultant, excuse me. She is a national speaker and educator, and she is very passionate about compliance and all things surrounding it. She's a certified insurance counselor and a certified professional compliance advisor. She's got over 20 years of experience, and she really knows what she's talking about. So go ahead and get her on here and get her rolling, and we'll start with some unemployment flexibilities. Angie, go ahead and take it away.
Awesome. Thanks, Alex. Welcome, everybody, to our Part 2 webinar. I know there are rapidly changing rules and regulations, and certainly a vast number of questions coming to us daily. As Alex said, please keep your questions coming as we are planning out next week's events. We want to make sure we're covering topics that are of importance to you. As always, we're here to support you. I want to start off regarding unemployment compensation. There are lots and lots of questions coming around regarding, if your particular state or federal government are asking you to close down businesses. Unfortunately, that is causing a lot of employees to be laid off or furloughed. Part of the new legislation that was just passed, the 18th, there are certainly some new facets about that in the new legislation. So please be sure to check your state's unemployment insurance website and program regarding the rules in your state. Essentially, what this piece in the law is doing is enhancing and making some more flexibility to what we already know and utilize about unemployment compensation. Certainly, the federal law is applying to employers who have to temporarily cease operations due to coronavirus. If they cannot allow employees to come into work. I know that I'm in the state of Pennsylvania, if you're not aware of that. And yesterday at 5:30 p.m. Eastern time, our governor basically suspended the majority of business in Pennsylvania, except for those with life-sustaining types of businesses. So it was a very fast turnaround that we had to kind of cease operations. Certainly, if an individual is quarantined, if the individual has to leave employment due to risk of exposure, these are some of the new pieces that will allow our employees to seek unemployment compensation. What we are seeing certainly is some key factors. They are suspending that waiting week, and a few other pieces that we'll cover here shortly. I know that you all are kind of all over the news as well as I am, and it really is an unprecedented time for us in America. Just looking at statistics from the week before or 2 weeks ago, when it comes to the figures of unemployment compensation claims, just in 1 week we had a 70,000 person increase. That will likely triple this week once the statistics are in next week. So certainly be prepared to arm your folks with information about your state's unemployment website and how they can immediately submit their claims in there. Alex, go ahead and switch. With regard to the Fair Labor Standards Act and teleworkers or telecommuting, it seems to me that a lot of businesses would be on par for something like this, but we all know there are tons and tons of industries that, you know, their workers are absolutely unable to telecommute or work from home. A lot of businesses aren't really prepared. If they can send their employees home to work, they're not necessarily prepared to do that. So a couple things to be mindful of with the Fair Labor Standards Act. If you are sending workers home to telecommute, you've got to be careful of some of these stipulations with regard to pay. You know, the FLSA rules are still going to apply as far as time and a half. If you have salaried or exempt workers, if they are doing any kind of work, they're there to receive their full salary. So please be mindful that some of these laws are not changing. Alex, go ahead. So despite the fact this law just passed, of course, there is very minimal guidance so far. What I've been able to glean from some of my resources and the Department of Labor, certainly this pandemic is not an excuse for not abiding by minimum wage rules. Regarding costs, I know that when you're looking to quickly make a plan for employees to telecommute or work from home, any costs that they're going to incur for internet access, computers, additional phone lines, things like that, that, you know, a lot of employees aren't necessarily prepared for the extra technology needs when they're working from home. Just keep in mind, employers cannot require employees to, you know, pay for these items and things like that. Employers, you must be prepared to keep accurate records of hours worked for all your employees. I know this is going to be a bit of a challenge. Please consult with your IT vendor or your IT department on how you can keep track of hours, especially for your hourly workforce. Certainly, the Department of Labor is encouraging employers to be very accommodating and as flexible as possible. I know this is a very uncertain time. As humans, we are emotional people. We tend to panic a little bit, of course. This is a time that I don't know that any of us have ever experienced something of this magnitude. So, you know, please be mindful of that when it comes to your employees. Be accommodating and flexible if at all possible. You know, having alternative work arrangements, additional time off, borrowed PTO for those that maybe haven't accrued enough. You know, these are all things to kind of be mindful of. Alex? So when it comes to telecommuting, a few tips. I know we have about 30 seconds, sometimes it feels like. Here in Pennsylvania, we got the order at 5:30, which was essentially when a lot of traditional businesses were already done for the day, and we had to kind of have that in place by 8 p.m. last night, so not a lot of time. So I wanted to throw out some tips for employers to be prepared. Have the infrastructure in place. If you've not done so already and you have the type of industry where you can look to telecommute some of your staff, talk to your IT folks about getting that infrastructure in place. Take an inventory of the types of equipment that are needed to work remotely. We certainly have a pretty full checklist. We'll be happy to send that out should you need it. Digitize any relevant physical materials. A lot of us are still in industries where we use a lot of paper. So make sure that you've got all of those items digitized and ready. Have the right cloud-based tools in place. We've got to be very careful about limiting security risks as well. We talked about Wednesday that there was an attempted attack on HHS. So hackers are out there. There's a ton of new phishing emails going around. It's a very scary time. So make sure that you are ready for any potential security risks, especially when you've got employees or workers who are no longer in your place of employment, but perhaps working from home. Consider what this means for your organization. Establish guidelines for working remotely. Again, we have a great checklist to help you with that. Be mindful of time zone differences. Certainly over communicate with your staff. They are looking to you for updates, for support, for what's going on in, not just your business, but your community and your state. Be ready to manage conflict. If you've never dealt with telework or employees who telecommute, in the event you get 3 or 4 emails, usually a good rule of thumb, 3 or 4 emails that, an employee is struggling with something, pick up the phone and call them. Utilize some of the cool technology out there. There's a lot of free webinar types of services, and sometimes you just need to jump on Skype. And, we don't all like to be on camera when we're in meetings or webinars, but, it's certainly a way. Sometimes you just need to make that eye contact, even if it's virtually. And, check in with your employees regularly. Be flexible and certainly support wellness. This is a health issue with coronavirus, so certainly there are tons and tons of tools out there by the CDC and the World Health Organization. Those are great pieces of collateral to send out to your employees regularly. Alex? So let's get into the nitty-gritty about the new legislation that was passed. Wednesday, we talked about the variety of pieces in the law. Certainly when it passed the Senate, there were some significant changes made to it. So I want to cover a few of those areas and what is really most predominantly on our minds right now with the state of our nation. So first and foremost, the Emergency Family and Medical Leave Expansion Act. This will actually begin, if not before April 2nd, on April 2nd. So anytime a law is signed by the president, it takes up to 14 days for that to truly be in force. So we're looking at the date of April 2nd. This does have a sunset provision, meaning it will expire on December 31st. Previously, there were 3 areas that an employee could utilize this emergency FMLA. When the Senate passed it, it was changed down to 1 area, and that area is for eligible employees, which means anyone who has worked for you in the last 30 days that cannot work or telework because the employee has to care for their child. That would be anyone under the age of 18 whose school or place of care has been closed or whose child care provider is unavailable due to an emergency declared by federal, state, or local authority regarding coronavirus. Previously, when the bill came through the House, it had health issues. So if you, the employee, got sick from this, or one of your family members. They removed that portion because they feel it's going to fall under a traditional FMLA. So the emergency FMLA expansion is just now regarding if your children's school are closed, which across the nation, I really don't know of any schools that are open at this point. So this is one of those qualifying situations for this emergency FMLA. Secretary of Labor may exclude healthcare providers and emergency responders from being able to access this. Department of Labor has the authority to issue regulations, certainly to some small businesses. We know that businesses with fewer than 50 employees, something like this could certainly jeopardize the viability of the business. First 10 days are unpaid. If an employee has any accrued leave, PTO, vacation, sick time, whatever, they are certainly able to use that for those first 10 days. The remaining leave is to be paid by the employer to the employee no less than 2/3 of the employee's regular rate. Now, there's a cap on this, $200 per day. Alex, I think we lost your screen. Thank you. There are certainly relaxed job restoration provisions. So in traditional FMLA, the concept of it is to not just protect benefits, but also to protect the employee's job for when they come back. The DOL has relaxed some of those provisions for businesses with less than 25 employees. And they've done that because a business that small may have to replace that employee if need be to continue the critical operations of their business. This does not increase the traditional 12-week limit of FMLA. So if you have an employee that has taken FMLA in the last 12 months, again, based on your measurement period, if they've already used a few weeks, they don't get the full 12 weeks for this. So it's still a total of 12 weeks, whether it's traditional FMLA or this emergency FMLA. Alex? Let's talk about the emergency paid sick leave. This is 2 weeks of pay. Again, going to begin, if not before, it will begin on April 2nd. It does expire on December 31st. The rule is if an employee cannot work or telework due to qualifying reasons, regardless of how long that employee has been employed. Employers of healthcare providers or employee of a healthcare provider, emergency first responders, those may be excluded from this as well. Certainly, the reasoning behind this is if everything else is kind of going down, it's our healthcare and our first responders that are still going to be of critical need to all of us. An employer with under 50 employees may be able to claim an exemption. There is very little to no guidance on this yet. We are keeping an eye on it. Full-time employees, this is 2 weeks, so up to 80 hours. For our part-time employees, it would be the average equivalent number of hours that they would have normally worked in a 2-week period. There is no length of employment requirement. So in the emergency FMLA, an employee has to have worked for at least 30 days. There is no requirement in the emergency paid sick leave. This 2-week period is in addition to and not a replacement of any paid leave that the employee is otherwise entitled to. Employer may not require an employee to use their paid time off before this. And this does not carry over from year to year. Again, this is strictly in response to what is happening due to the coronavirus. So there are certainly rules around this. Alex, let's go to the next slide, and we're going to talk about the reasons that the emergency paid sick leave can be used and what the rates of pay are. So certainly if an employee is subject to federal, state, or local quarantine, or isolation related to coronavirus. If the employee has been advised by a healthcare provider to self-quarantine due to concerns related to coronavirus. If the employee is experiencing symptoms of coronavirus and seeking medical diagnosis. The testing procedures right now for coronavirus, it's going to be a bit challenging. I know for me, where I live, I think it's an 1.5-hour drive right now to get to an approved testing facility. So, you know, it's not an easy process sometimes to go get your medical diagnosis. These first 3 items, if one of these 3 reasons is a reason the employee needs to use this emergency paid sick leave, this is to be paid at the regular rate, capped at $511 per day or $5,110 aggregate. The next 3 items have a different cap. So the next 3 items would be if an employee had to care for an individual who is in quarantine or isolation based on federal, state, or local order. Now, this is a significant change. Previously, it was to care for a family member. The rules changed, and it is now an individual. Again, very little guidance on what that means, but it has changed. To care for an employee's child, if the school or place of care, child care, is unavailable due to coronavirus, if they were closed or precautionary. If the employee is experiencing any other substantially similar condition specified by Secretary of Health Services, you know, that's another reason. Again, some of these can be a little vague, and I apologize that there is little to no guidance yet on these. The last 3 reasons, the rate is capped at $200 per day or $2,000 aggregate. So definitely some changes from what we talked about Wednesday when the pending legislation was still out. Now that it's enacted, definitely changes in place. Alex? So I want to go back again to the unemployment. I know that your employees are going to have tons of questions, especially as more businesses are required to close their doors. Those that do not have a way for their employees to telecommute, or an industry that doesn't allow such a thing, such as manufacturing, for example. So the Emergency Unemployment Stabilization and Access Act, again, states are to remove the requirement for work search. If you've ever applied for unemployment, part of the rules around that is while you're on unemployment, you have to look for new work. This requirement will be removed. Removing the waiting week so that we can get claims approved quickly. Also removing good cause and employer experience rating. Just popped in here an excerpt from the actual piece of legislation. So hopefully, as more and more employees are being laid off, they can quickly get to the unemployment compensation that they need. Alex? I'm getting a lot of questions, seems like by the hour, about furloughing, laying off, reducing hours. I wanted to go through this again, talk about what employers need to consider. We use furlough and layoff kind of synonymously, and really they're very different in definition. So a furlough is a mandatory but temporary unpaid leave. It's generally a short-term solution. Employees are generally under the expectation that they will return to their jobs. There's also a traditional time limit. When a furlough occurs, employees must be called back within a year. There's a rule in place called the no work rule, that if an employee is on furlough, they can do no work for that employer. Doesn't mean they can't look for another job if need be, but they cannot do any work for their employer who has furloughed them. In some situations, an employee may be able to maintain their employer-sponsored health benefits during a furlough. It's very important to consult with the laws of your state and your insurance carrier's contracts to determine if that's even possible. It may be in some states. A layoff is also known as a reduction in workforce. It's generally a more long-term or permanent solution with no guarantee of being called back. Please be sure if you are laying off that you are immediately turning around the offer of COBRA. I did receive word today from my lobbyist friends who have notified us, and certainly they're pushing this out on social media and notifying as many folks as they can, that some state marketplaces, state exchanges for individual coverage are adding a special enrollment period. Obviously, in the wake of a global health pandemic, the last thing we want as a nation is to have folks out there with no health insurance. Obviously, if you're laid off, one of the traditional rules is if you are laid off, that's a special enrollment period. You will have the offer of COBRA, but I'm excited to see that some state exchanges are opening up some new special enrollment periods in general. I would hope the federal marketplace, which houses the majority of our states, will throw something out there as well. Hours reduction, we are seeing this in our bank of questions being asked. If you have employees that are full-time and you have to reduce their hours, I know employers are looking for any type of solution to try to keep their employees employed for as long as possible. Some have to reduce hours. Payroll's a huge expense, and they need to be able to try to keep their doors open as long as possible. Be very cautious when you are looking at when am I supposed to terminate benefits and offer COBRA. If you're in an industry that has an established and documented measurement period, hospitals, restaurants, hotels, anything in the hospitality space, you most likely have a measurement period for your variable hour employees. You're measuring them to see if they ever transition over into becoming benefit eligible. If you have an employee that's currently in their stability period, even though you may be reducing their hours right now, keep in mind, if they're still working, even reduced hours, and they're in their stability period, you cannot remove them from the benefits. Full-time to part-time is going to trigger COBRA. Please inform employees if they are having their hours reduced and you have a flexible spending arrangement or a dependent daycare arrangement, that this is a time when they are able to make some changes to the normal contributions that they have going into their flexible spending accounts. Being that it's a change in their job status or hours, that's allowed. When it comes to termination, I know we don't like to terminate. It is going to happen. Please be aware when you're actually terminating. So you're not furloughing, you're not necessarily laying off, you're reducing hours, that's okay. If you're actually terminating, be aware that your state may require payment of unused paid time off or vacation time or sick time, severance pays if that's a requirement by your state or industry. Please be aware of your federal, state, and local laws. Certainly offer COBRA as quickly as you can, and seek guidance. I spoke with some of my colleagues out there that administer flexible spending accounts on a regular basis. There is no guidance right now on, if I have to lay off or, terminate an employee, what happens to the balances that are currently sitting in their flexible spending or dependent daycare accounts. As soon as we get some updated guidance on this, we will get that circulated to you all. But even our FSA carriers out there do not have any advice yet. Alex? Key takeaways, not much different than last time. Please review your state labor laws, insurance carrier provisions. Communicate regularly with your employees, over communicate. Trust me, it will give them a sense of ease and comfort. Review your current leave policies. There are so many things changing, and they're changing very, very rapidly. I know that as a society, we are becoming reactive. If you can be proactive at all, please do so. I know it's challenging. We get very little time sometimes when rules and laws are changing. Plan for required documentation to employees. Now that this legislation is passed, we are watching diligently for guidance from the Department of Labor. I know there will be required communications, documentation, poster requirements. I'm sure there are going to be updated FMLA forms coming out very quickly. We will certainly let you know as we see those things. Certainly leverage your resources to support each other. To give you an example, for me, I am leveraging my tribe, the family that I am with, you know, whether they be first responders, police, legislators, my colleagues out there in the world, regardless of what state they're in or what industry they're in, they can support all of my research and certainly get to things possibly quicker than I can to help so that I can share those with you all. And as always, pay attention to reputable sources, you know, those government websites, which we're going to post here in just a moment. Be careful of social media, be careful of tabloids. Those may not necessarily be as credible. Alex? These are some great resources. Please jot them down. Certainly after this webinar is concluded, we will have a recording of it. We'll post it to YouTube and share that with you along with the slide deck so that you can go back through it. Our contact information should be coming up here next. Please don't hesitate to contact us. Alex, go ahead and switch that slide. We would love to know, what are your questions? What have we not answered? What are concerns you are having? Please shoot those over to Alexandria at navigatehcr.com. Those of you who are accustomed to communicating with me, Angie at navigatehcr.com, please don't hesitate. We want to know, what are your questions? What are your concerns? In and around what we're all going through. I want to make sure that future presentations, future podcasts, white papers, I want to make sure we're addressing your questions and concerns as quickly as possible. So please, I know a lot of you are awesome about getting me questions as quickly as you can, but for everyone else who's listening, please do so. We are going to do a live webinar next week, same time on Tuesday and on Thursday. If that changes, we will certainly let you know. Invites will be on their way so that you guys can get those added to your calendar. Some of our team, you guys know from last time, and again, don't hesitate to get a hold of us. Email, text, phone, whatever it is, we're happy to support you all. I think that our change in platform has caused an issue with our Q&A, so we'll figure that out for next time. And certainly we are happy to be a resource for you all. We are looking to leverage some additional resources in our upcoming presentations when it comes to areas that maybe are not in Navigate's wheelhouse, bringing together quite an array of folks to join me on future webinars. Follow us on social media, please. We are going to have rapid fire updates as we get them. Social media will always happen first as we prepare for future webinars. And with that, I appreciate your time and your attendance. I look forward to answering your questions and being a supportive resource for you in any areas that I'm versed in, and those that I'm not, I will find the resources to support you. Alex, any final comments before we wrap up?
Nope, and I apologize for not being able to use the chat box. Please, please, please make sure to send us your questions. When we get the recording posted to YouTube, I'll make sure to send out all of those questions as well. And we really look forward to having some of your questions on the call next week as well. And yeah, we appreciate all of you guys hopping on and listening, and we look forward to seeing you again soon. Have a great weekend.
Thanks, everybody. God bless. Stay safe out there.
Bye.